Everyone, joining us now is Clay Skip from Medicare Health Options. How are you today, Clay?
Doing good. How you doing?
I'm good. Thank you for joining us here on the show today.
Absolutely.
So now it's been about a little bit over a week that open enrollment began for Medicare. So how's that going so far?
It's been wild. It's been we get super busy this time of the year. It's obviously it's a time when everyone changes. They look at their options. They evaluate if they have the right drug plan, the right plan for their medical and hospital, and it's when new programs come out too. And so it's just a super busy time. My phone's blowing up every day. And like on Mondays after the weekend, it's like I get slammed. But it's been very busy, very fun, and just seeing a lot of people. We're at the Medicare Resource Center with Disability Connections Resource Center in the Hobby Lobby parking lot. We've been having a lot of people come in there. A lot of people from Social Security walk over, and word of mouth too. It's like people will come in and they'll work with us and they'll see what we do, and they realize how valuable it is, or we help them out a lot, and they'll come back later that day with a friend or a family member who's needing help. And so that's been really cool. It's showing us that we're really doing good, because they're literally leaving and coming back with a friend or a family member. So it's been really good. There's been a lot of change out here, a lot of new options, and a lot of people are very underserved. And especially even working with the Disability Connections Resource Center, they help a lot of people in disability. A lot of times people in disability, when they get their Medicare, they slip through the cracks because there's certain plans they don't qualify for, and they don't fully understand it, and basically they don't get the help they need, just because Medicare is super confusing, and they don't qualify for certain plans, and so then they get discouraged and don't investigate it anymore. But there's other programs they can qualify for, but they just don't know. And so we've been seeing a lot of that from being with them. And then just from being next to Social Security, we have a lot of people who are new to Medicare. They come over, and a lot of people are just very misinformed, and it's been a good thing. It's been really good.
Yeah, and a lot of people here in the Concho Valley do rely on Medicare, so whether they're new to it, they definitely might have some questions, or even if they've been on it for a few years, every year there are things that change.
Oh, especially for those people, because the past few years, the Medicare market it's changed dramatically with the options that are available and how the plans work. And for people who've been on Medicare for a while, they're especially the ones who want to look at it, because a lot of times they're in plans that are outdated and they're super expensive, and they're paying more than they should, and they don't realize that they can qualify for different programs that are much more affordable. I mean, now there's new programs that are $0 a month, and they cover all their stuff. They cover their hospital, medical, and drugs. There's new programs that offer dental and vision, and Medicare doesn't help out with that. But with those programs, that's so big, because I mean, it's obviously vital to your health, but Medicare doesn't deem it as medically necessary, and so they don't cover it. But yeah, we've been helping a lot of people save money on different co-pays, co-insurances, and on their premiums. Today we sat down with some people who were paying about $300 a month for their drugs. They had no drug coverage through Medicare. We helped them get a drug plan, and now they'll basically be paying about $0 a month.
Oh, wow.
Almost, yeah, it's pretty crazy.
Yeah, that's awesome that you're helping people that much. That's great.
Yeah, no, it's been great. It's been very well. It's gone very well.
Anyone who wants any Medicare help, what do they need to do? Do they need to set an appointment?
Yeah, we usually have people call in, or they come up there. Usually we're up there. We'll have somebody up there. If we're not up there, we're out doing an event or something, or doing some kind of outreach. But we do home visits too sometimes. But yeah, they can call us, or they can come up there to the Medicare Resource Center. We're going to have the number up, aren't we?
Yes.
Okay, 325-776-7007. Yeah.
Yes, all right.
Perfect.
Is there a date that they need to do all this stuff by?
Well,
I mean, the sooner the better, I would assume.
Absolutely. For most people, they want to make a decision before December 7th, because the open enrollment is October 15th through December 7th, and so they want to make a decision before then. But then even too, there's certain people who have chronic conditions that they can qualify right now. We've seen 2 people this past week who they had no drug coverage, and they're diabetic, and so we helped them get coverage very quickly, and so that's huge for them, because they're paying $400, $300 a month for their drugs.
Definitely.
So
that's awesome.
It's very expensive.
Yes, for sure. So if you are on Medicare, or if it's the first time that you're getting on Medicare, or even if you've been on it for a few years, once again, the Medicare Resource Center is available to help you out in any way that you need. That is going to be open from 8 a.m. to 5 in the afternoon. They are located at 2809 Southwest Boulevard. That's in the shopping center where Hobby Lobby is. Also, the Social Security offices around that area. They have a big sign, so you can't miss it. You can call that number on your screen for more information, 325-227-6624. Clay, thank you so much for joining us today. Appreciate it very much.
Absolutely. Thanks for having me.
Yeah, I'll be right back after this.